Start చేయాలా?
Yes, sir. 1 second. Good afternoon, everyone. Today's topic is distal radiation joint injuries. We are glad to have Dr. Pappu sir with us to guide us on this topic. Sir, please take over the session.
Okay, thank you. Last time we have discussed about distal radius fractures. So with this time we are going to discuss about distal radioulnar joint injuries because most of the time these injuries happen concomitantly. When you have fracture at the distal radius, you will have some instability or injuries at the radioulnar joint also or the distal ulna also. So it is apt to discuss about these injuries also. So distal radioulnar joint is formed by the concavity of the radius and also ulnar head. So distally, and it has many ligaments. They are dorsal and volar palmar and dorsal ligaments. It also has triangular fibrocartilage complex in this. So these are all part of distal radioulnar joint. So whenever there is an injury at the distal radius, these all might happen. This joint and this structure might also get injured. So, what are the most common injuries which cause distal radioulnar joint injuries? One is distal radius fractures. This is the most common cause with distal radioulnar joint instability. Next is triangular fibrocartilage tears. So, ulnar styloid fractures also cause distal radioulnar joint instability because there are many types of fractures of the ulnar styloid, that is type 1, type 2, type 3. Type 3 fractures are the most commonly fractures associated with distal radioulnar injuries because it is where that base of the ulnar styloid where the TFCC gets injured. Once this fracture at the base happens, distal radioulnar joint becomes unstable. So Galeazzi fractures, distal radius fracture, where you might see very commonly distal radioulnar joint dislocation and also ligament disruptions. Essex low pressure injuries, this also very commonly causes when you have a radial head fracture, it might injure your interosseous membrane, leading to the instability of the distal radioulnar joint, and also isolated distal radioulnar joint dislocations also you might see without all this. So now we'll see. See, this is distal radius fracture. What happens in a distal radius fracture is that when there is a fracture and associated ulnar styloid fracture, this displaced ulnar styloid fracture will displace the distal radius fragment laterally, radially. So that causes instability. So sometimes this might get this also might have an associated injury of the dorsal oblique band of the distal radioulnar joint. So most of the time, this ligament stabilizes this distal radioulnar joint. So it is very important to check for the distal radioulnar joint stability after fixing distal radius fractures. This is a classic Galeazzi fracture where you see the fracture of the distal radius on the left side. That is A, B, and it is associated with ulnar styloid fracture type 3, leading to the dislocation of the distal radioulnar joint. This is a variant of distal radioulnar joint on the right side, where you see both bones, ulnar nerve, both bones forearm fracture also causing distal radioulnar joint disruption. Essex lopresti. So here you see in the elbow fracture, when there is a radial head fracture, when there is a vertical transmission of force, that will cause disruption of the vertical disruption of the interosseous membrane and fracture of the distal radius. So it is very important to look for a distal radioulnar joint instability whenever there is a fracture of the elbow fracture or radial head fracture. So other than this, you will also have isolated distal radioulnar joint dislocation. These are very rare, but can happen when you fall on outstretched hand. So on an X-ray, you see a gap between these two bones in the distal radioulnar joint. This indicates there is a injury of the distal radioulnar joint. So what are the symptoms of distal radioulnar joint injuries? One is ulnar sided wrist pain, and also you will have a pain on the distal radioulnar joint groove. There is also a click or clunk sound sensation with movement due to the ulnar head moving abnormally. Whenever you move your ulnar head, it might dislocate from the fovea and you might get It might give a sound, clunk or click sound. Visible deformity, because whenever you pronate the distal radius, your ulnar head will be visibly prominent, and also you will have grip strength is weak, limited range of motion you will have because of the pain. So this is a piano sign where we see ulnar distal radial ulnar joint, ballotment. So when you check these two bones, when you hold them, these two will be moving independently. They should not be moving whenever you make any movement. So you can make independently both the bones, so that causes ballotment test. And piano sign is whenever you see a ulna overhead like this in pronation, just press it, it will go down like a piano key. That is called piano sign. So how do you diagnose this? X-ray is the most commonly used modality. Other than that, you can also use CT scan and MRI of the wrist. MRI of the wrist is very helpful in neglected cases where they have malunion of the distal radius or the malunion of the ulnar head or distal ulnar fractures. CT scan is very helpful in checking fractures, dislocation, and all that. You can very clearly see. CT scan, you can do a dynamic CT scan where you see CT scan in three positions. One is in fully supination, one in full mid neutral position, and the other one in full pronation. So in normally, whenever you do movements, ulnar head should be always in congruent with the radius, distal radius, radial ulnar joint. But in abnormality, what happens if you see these left side and right side images? See, when you are while making movements, the ulna might get subluxed or dislocated from the radial ulnar joint. So that is clearly seen when you do this pronation and supination movements. That's where your dynamic CT scan will help. Whether sometimes you might do it in neutral position, or when the arm is in neutral position, it is in the original position, it's not dislocated. But when you do it in pronation or supination, usually it gets dislocated based on the ligament is torn. So if it is volar ligament is torn, then it will dislocate in pronation, and when it is in dorsal ligament is torn, it gets dislocated in the supination. MRI will help in diagnosing these distal radial ulnar joint injuries. Mainly in the left side, you see the image of acute injury. So when you do an acute injury, you see all this T1 hyperintensities arrow marked. So it's suggesting that there is some injury of the soft tissue at the radial ulnar joint. But in neglected cases, you see this arrow mark where you clearly see the break in the ligament, continuity of the break in the ligament. So also this triangular fibrocartilage is little displaced in this image. So management, when it comes to the management, when there is only purely ligamentous injuries where there are no fractures, you can just put a slab, above elbow slab, usually put it in above elbow slab in neutral position where the ulna is centrally positioned in the radial articular surface. So this causes the ligament to heal. For 6 weeks we keep usually, and after that we start mobilizing. So in neglected cases, you cannot treat them, or in fractures you cannot treat them conservatively. So even in fractures also, if you get reduction you can treat them conservatively, but if you are not getting reduction you can't treat them conservatively. So when it comes to the managing distal radial ulnar joint instability in operated cases, first condition is that all your fractures should heal. There should not be deformities or malunions. If there are any malunions, you have to correct those malunions before attempting to restore the ligamentation of the ligaments of the distal radial ulnar joint. So this is one way of doing this. You take a tendon strip, pass it VV through the ulnar styloid and then into the radial distal radius, and then bring it back and tie it over the distal ulnar. In fractures, when there is a fracture and dislocation of the ulnar styloid or distal radial ulnar joint, you can have hook plate or a specific anatomic plates for distal ulna. You can fix it, keep it in position, and then keep it in POP for other ligaments to heal. So this is in other cases where there is you cannot do ligament structure. You have now we have tight ropes where you can use tight ropes. This is transversely passing. This is to distal radial ulnar joint. You can put it together, and it is very important to restore the function of the distal oblique ligament, pronator intraosseous membrane ligament. So if you restore that ligament, that itself stabilizes the radial nerve joint. So this oblique ligament tightrope is passed so that distal radial nerve joint stabilizes in this. So this is another way of treating distal radial nerve joint injuries. Thank you.
Thank you so much, sir.
Yeah, thank you. Same questions లేవా ఇంకా? సో ఎగ్జిట్ అవ్వచ్చా లేకపోతే ఎట్లా?